Good morning, everybody. This is Painless with Dr. Jasper.
That's right.
And Jeremy, we got a special guest today, which I'm not going to mention his name yet, but we got a surprise for you. New information about new stuff. And that's what we do here. Well, I'm an interventional pain physician, which means that I treat the pain generator. So you got to locate the pain generator, and you got to distinguish between doctors like myself compared to just plain pain doctors.
Mm-hmm.
Now, of course, this is my definition. I always talk about it. Everybody has their own definition, but my definition would be, if you go to a pain doctor, they treat pain maybe with pain medication and maybe with simple injections.
Right.
Whereas once you graduate into interventional pain, you do more of an interventional technique where you do procedures to get rid of the pain generator.
Right.
It's very simple. When you have something causing you to have pain, you have to be able to isolate it, find it, isolate it, and deal with it. That's the secret to a good interventional pain physician. And another thing that we do is we try the best we can to avoid any major surgery. And with the evolution of what's going on out there, every 6 months they come out with something new, which they considered minimally invasive spine surgery. We learn it. There's a lot of bogus stuff out there, but there's a lot of good stuff out there.
Yeah.
And I'm kind of famous for doing the good stuff. And we have the industry comes to my office to present these things to me. And if it's good, I use it. If it isn't, it makes sense. Plus, you got to look at the studies.
Sure.
And some of the things don't even have that much studies yet, but it's obvious that it works well by just understanding the technique and knowing the anatomy and knowing where the pain generator is and how it could take away the pain generator. Right. So that's all it is about interventional pain. And we do the basic stuff. In my practice, we don't prescribe pain medication. The only time we might prescribe some pain medication is if we do a minimally invasive spine surgery. It might give you some pain postoperatively for a day or 2 days. Then we prescribe some light doses of narcotics or any kind of pain medication we prefer at the time. But to deal with somebody with chronic pain on chronic pain medication, no, we'll take you into the practice. If you have an open mind to enable us to find where your pain generator is, get rid of the pain generator, and hopefully you can get off of your pain medication. It's not that we won't accept you into practice on pain medication. We're not going to prescribe it, so you already have somebody to prescribe it. But we'll try our best, and we usually succeed on getting you off of the pain medication by decreasing your pain.
Yeah.
Now, you got people that come in that are on pain medications, narcotics for years, 10 years. Those are the people who are very difficult to get off because they have a different set of mindset. Now, not all of them. Some of them really want to get off, but the majority of them have this mindset where if you got a headache, you're going to take a Percocet, instead of taking a Tylenol, instead of taking acetaminophen or maybe an aspirin or Motrin or Aleve to get rid of their headache. I mean, that's what you should do. Somebody has some minor arthritis, you take an Aleve, you take some Tylenol or something. But you don't just jump into. And this is a lot of them have that mindset. They jump into this, narcotic. That's the only way to get rid of pain. And it's a natural feeling the way they have. But anyway, so we do basic stuff. And I can tell you this thing keeps flashing on and off, but don't worry about it. We do basic stuff like epidurals. We do transfemoral epidurals. We do intralaminar epidurals. We do radiofrequency lesioning of the medial branch nerves, which is for the arthritis of the spine. And one of the new things that we've been dabbling in a little bit by request of patients is patients who has post-traumatic stress disorders. They request these specific types of injections that are sympathetic chain blocks, mostly stellate ganglion in the neck, that decreases the anxiety and the stress from post-traumatic stress disorders. And there's a lot of talk out there. In fact, I heard on the radio today that they're talking about bringing in magic mushrooms to treat post-traumatic stress.
Really?
You ever hear that?
No.
I mean, that's like a new thing, and it's in Oregon. Like now, anybody wants to be treated, they got to go to Oregon to get treated because it's not legal in most other states.
Sure, sure.
Now it's accepted in Oregon. So if anybody's listening, they got the post-traumatic stress, you have to go to Oregon and take some magic mushrooms. Psilocybin. They call it the psychedelic treatment for post-traumatic stress syndrome.
Oh.
But these are cool factors that you start to learn. And I tell you what, if they prove through studies that this is something that works, the Jasper Spine Institute is definitely going to get involved with that. We got involved with it in college, so we might as well get involved with it now. we got a lot of experience with those psilocybin
Sure.
Well, of course, not me personally.
Yeah,
not me.
You have to experiment, though.
Anyway, so like I said, what we're famous about is these minimally invasive spine surgeries, like endoscopic, which is like an arthroscopic spine surgery. Like they do arthroscopic surgery of the joints. We do it of the spine. The people who do minimally invasive endoscopic spine surgery, we do it through a little tube, which is a scope, which we see on a nice big monitor, a high definition monitor, TV screen. Mm-hmm. And it's like playing a video game. I see the herniation, I pull it out, pain generator's gone, the pain goes away. Simple.
Right.
Bone spurs, we trim down the bone spurs. Also spinal stenosis, we put the interspinal spacers in to open up the spine. I can get into more detail, but this is just, overall thing of what we do, because we're gonna get involved with other stuff here today. But with that, we really take care of a lot of patients, and they do well. They do well. It's amazing how patients do today with as far as the results with these minimally invasive spine surgeries. People ask me, are you a spine surgeon? Oh, that reminds me of a joke, but I'm not going to say it. Are you a spine surgeon? I don't know. Am I a spine surgeon? I'm not a board certified neuro or orthopedic spine surgeon. I haven't done my fellowship training in orthopedic or neuro spine surgery. But guess what? I operate on the spine.
Sure.
And I operate on the spine with very small incisions that I've learned over the years, the last 27 years, I've learned through the evolution of minimally invasive spine surgery that a lot of the major spine surgeons refuse to learn, because we kind of been knocked down as far as economically. We don't get paid much for it, so most people don't want to do it, especially the surgeons that get paid big money for the big surgeries. But I've learned over the years, now they say, well, you know what, you're not qualified because you didn't take a fellowship training in neurospine surgery or orthopedic spine surgery. Well, the neuro-orthopedic spine surgeons is doing this today. They never learned that in their fellowship training because it didn't exist.
Right.
Now, this is 27 years later, 30 years later, 10 years later. They didn't know it. But this is people who they further their education, and they do the continuous medical education courses and are enthusiastic and ambitious on learning the new procedures to help people. Will learn it.
Right.
All you need is good hand-eye coordination, common sense, and be safe, and you'll be good at it.
Yeah.
And of course, I've had surgical training. I did a surgical residency, preliminary, part of my residency training. So I am a surgeon, and I'm an anesthesiologist, and I'm an interventional pain doc, and I'm a pilot, and I ride motorcycles.
Race car driver.
Hey, by the way, today is a very, very important day for me. After studying, 4 or 6 months for my instrument test to become an instrument rated pilot.
Yeah.
IFR pilot. Today at 1:30, I will go to the center and take my exam. And I think I'm prepared.
Oh, very awesome, Doc.
I'm pretty much prepared. I should be prepared after all this time. But anyway, that's what we're going to do. But, when I say we do this new stuff in our practice, excuse me, part of the new things that we do is this regenerative medicine. You know, people come into my office and say,
That's right.
Doc, you know, what is that stuff? But there's so many good things about regenerative medicine. But there's one bad thing about regenerative medicine. The insurance companies are holding out as long as they possibly can to not pay for it. And they've proven through double-blind prospective studies, retrospective studies, that it works. And there's tons of companies out there that are mastering the best product to use, and they're all basically good.
Mm.
You know, it's you know, who sells it to you, who follows through with it, and I just happen to have a guest here today,
That's right.
Marco Battaglio. Did I say your name right? Battaglio,
Yes, you did.
not Pataglo.
Nope.
It's
That's
Battaglio.
true Italian.
Mark is here, and
Marco.
Marco is here. Sorry about that. I said it
No
right the
worries.
first time.
Yup.
Yeah.
Marco is here, and he's going to introduce what he presents as regenerative medicine.
Yeah.
You know, you got stem cells, you got PRP, you have all stuff related to the what do you call it, like embryonic tissue.
Yeah. What was
You can use fat tissue and produce actual stem cells with that. You could take stem cells, retrieve it from your own bone marrow and spin it down. There's so many different techniques. Some of them are invasive, some of them are non-invasive, some are very simple.
Mm.
Now, Marco is going to present his product, his company, and how it's going to help you, and the mechanism of how it helps you. Marco, you got the stage here.
All right. So, thank you for having me. It's my first
Is this
podcast
close enough?
here.
Yeah, that's close enough.
Cool.
Oh yeah, you want to put it up in your mouth there? Yeah.
Good.
That's
Don't
it.
cover your face.
Yeah.
So, today we are going to discuss a system called EndoRet, PRGF, short for Endogenous Regenerative Technology, Plasma Rich in Growth Factors. I know that's a mouthful, but we have a mouthful of results that are intriguing to anyone listening to maybe see if this is right for your current therapy.
That was a good segue.
So, I know you may have heard of PRP, as that is something that has been offered at the Jasper Spine Institute, but now you are hearing the acronym PRGF. So where did it come from? How long has it been out for? And why would you ever consider coming out of pocket for a procedure like this? So this was created by a company, a manufacturer called BTI, short for Biotech Italia. They have been around for 20 years and have tremendous success.
They're from Italy?
Yes.
Oh
Yep.
my goodness.
Italy
I didn't even know that.
Yeah.
That's all you had to say in the beginning.
I know.
Open with that next time.
Yeah, right. Italy and Spain, I believe, are their two main headquarters, but their presence is in 45 countries today. They do very well, and they have tremendous success in pain management and aesthetics. But what really makes them stand out, so they are the first and only company that has managed to share publications that we can preserve the life of the growth factors past a 21-day period in the injected area of the patient. So just to clarify or simplify for any of our listeners, any PRP treatment, any PRGF treatment, or PRF, any of the other acronyms in this field, the goal is to simply take your blood, we spin it through a centrifuge machine in order to separate the platelets from your blood. So you'll have the red blood cells at the bottom and the plasma on top. And then we are going to re-inject the plasma into your anatomy for cellular regeneration. So what makes ours different is that instead of just mindlessly injecting the platelets, hoping for cellular regeneration, the problem with this sentence right there is that the platelet is the carrier for the components that actually have the regenerative effect. They don't actually do the regeneration itself. Okay, so if they are the carrier, they are the ones bringing the proteins, the growth factors, and the goal is to release everything inside so we can have a plasma rich in growth factors, hence where we got our name from.
Okay, let me stop right there. It's a lot to swallow. So now, just to clear things up for the people listening, platelet-rich plasma, PRP. What you're doing is you're spinning down from your whole blood. You're spinning down. You're separating the plasma,
Correct.
platelets, and then you spin it again. Now you have platelets plasma that has a much richer platelet mix. So there's a higher concentration in platelets. And they say that the platelets contain the growth factors, the chemotactic structures to call upon this is what I understand, call upon your own growth factors, call upon your own stem cells in your body to regenerate the tissue that's broken down, basically, right?
Correct.
Now, tell me if I'm right. What you're saying is that the platelets are what contains all these growth factors and chemotactics.
That's correct.
On the inside or on the outside?
On the inside.
On the inside. So what your product is doing is you're not, what are you destroying the platelets? Or are you separating?
Right. So we are putting it under immense pressure with our activation. In our whole protocol, we have a substance called calcium chloride that we add, as you've seen in the procedure. That's the activation. Once we add that puts them under immense pressure to where all the proteins and the growth factors are then being released from the platelet itself. So after that takes place, there are no longer platelets in the plasma. The whole reason why they came up with this is because we were able to conclude a lot of these PRP companies, when they are injecting this platelet-rich plasma, it can and may have a regenerative effect, but to really ensure the long life expectancy of the growth factors, we make sure that we release all of them. There's plenty of studies out there that show you could be injecting these platelets, and if nothing is releasing, and this just goes back into your bloodstream or takes up excess room in that fibrin matrix that it creates once injected, it's virtually useless. So that is where we are able to activate all the components inside, as you said, and make sure that their presence stays there for as long as potentially a 21-day period.
21 days.
Yep, which is significant because the closest PRP system, they don't have any publications past 72 hours. And as far as PRF, it is 7 days. So it is definitely, significantly longer than what we've currently been used to in the industry.
The PRP. So basically, what happens to first of all, platelets aren't even cells,
right?
Right?
No
they just contain all this good stuff. So I guess when it comes out of the platelets are just lingering around there, and they don't do anything at that point.
Right.
So it's it doesn't really matter. And once it gets in that area, what does it do as far as how does it help the damaged tissue?
Right. So great question. So as you were saying, bringing up stem cells, when we are younger, we have a large quantity of these in our body. I'm actually currently doing a fast, which can help reproduce stem cells. If you make it to that 72-hour point past autophagy, your body will naturally start to replenish, just naturally producing stem cells. So what the PRGF system does, it looks for these stem cells in that area. Now, it can have a very similar effect even in, let's say, an elderly patient, 60 plus, to where maybe they didn't exactly take care of their body. And, even if there wasn't as many stem cells present, it still could have a regenerative effect. What these growth factors are designed to really do anywhere in our body is just target anywhere that's in need of reparation, is my understanding of the procedure. So if you have a torn ligament, torn tissue, inflammation such as arthritis, wherever it is in your joints, this is a great way for that to potentially bring down this inflammation and make the reparations needed. But now for, let's say, again, if it's an older patient, that's where we've actually seen studies where they combine the stem cells and the endoret system to where you're intertwining this procedure to have, say a very significant.
What do you mean? You're combining what procedures?
Stem cell injection with the PRGF.
Like where do you get the stem cells?
So this is another solid question. So there's a handful of companies out there. I wouldn't recommend doing this anywhere outside if it's a fully autologous procedure. If it is not extracted from the lining of your stomach, that's typically where they extract the stem cells from. The excess fat, that's typically where you'll see it from all ages. But there's other companies that may get it from umbilical cords or placentas, and maybe
I don't know if those are really stem cells.
Well, some of these companies may argue otherwise, and I agree with what you're saying because, these are it's matter that is kind of decaying, and I don't know how much life is exactly going to be there, but they have no problem charging $4,000 or $5,000 for
Yeah,
these,
they take advantage of a lot of people.
for sure.
You got to be careful because you go down to Florida sometimes. I had a friend of mine who had a daughter that has I think I'm not sure whether it was MS or lupus. I think it was lupus, and she was very young, and she heard about a doctor for $11,000 in Florida giving intravenous stem cell treatment,
Oof.
and intravenous stem cell treatment. And this is already 10 years or more
Right.
ago, and it wasn't even proven yet. That's when 10 years ago they used to get away saying they had stem cells from from a placenta or umbilical cords and stuff like that, but they really didn't. They were robbing these people. Now you think about this poor lady's got a 12-year-old daughter with lupus who's sick. She'll pay, and she doesn't even make that much money. She's probably beg, borrow, stealing to make the money to go down there, and they screw you. So you got to really do the research before you start doing this kind of stuff. We give injections in our office. We live in Toms River, Bricktown area, Ocean County. This is not a rich neighborhood.
Right,
You got some people that are in higher bracket and lower in this, but overall, it's not a rich community. We charge reasonable prices to do it. We don't. It's not something in my practice that we make to make money. It's basically in my practice we do it as a courtesy for the patients that are interested in doing it. A lot of stuff we do in our office as a courtesy. Because you just can't. I mean, if you say, "All right, I'm going to charge you $10,000," forget about it. Nobody can afford it, so it's a waste of time.
Yeah.
So you just charge a little bit more than what it costs, the product costs. So it gives you good access. Patients have access to it, and you're helping patients. That's our model.
Right.
But I've actually used this product.
You did.
I can endorse it because I used it. It was in my thumb, right? Or was it my shoulder? I got so many problems.
Your shoulder.
My shoulder, yeah. My shoulder's doing pretty good, but you got to take into consideration how messed up my shoulder is.
Right.
My shoulder, if you look at the x-ray, it looks like a bag full of nickels. It does not look good. And it helps it to a certain extent. Now, if you get somebody maybe in their 50s that has the beginning of arthritis, a beginning of let's say rotator cuff problems, and you inject it with this stuff, you're gonna have much better results.
Absolutely.
Right? Because you have more to work with. Somebody like me, what you're basically doing is, in my opinion, if you have anything else to say about it, is you're delaying the
inevitable
time that I have to do a new shoulder. I got one on my left side. I need one on my right. But it's been at bay because of this stuff so far. But I'm going to eventually need a new shoulder. My rotator cuffs are pretty good because I never tore any of them. But the longer you wait with osteophytes, especially in the subacromial process, it can start to tear up your supraspinatus muscles, which is part of your rotator cuff. But so if you need a shoulder, don't procrastinate too much, and I'm procrastinating too much. But what else was there? Do you know anything about exosomes?
Exosomes.
Oh, they're exciting. I liked.
Do you know anything about it? I mean, I don't know much about it. I know a little bit about it.
Yeah, so we definitely have ran into a number of different practices that are utilizing them. However, it is still not an FDA approved procedure. So there are some physicians that don't pay too much attention to that, and they're actually injecting it. And it reminds me, similar to the story that you just said about the woman whose daughter had lupus, and now they're charging $12,000 for stem cells that may or may not have actually been stem cells. So one thing that is interesting, I was reading, whether it's exosomes or stem cells, you are injecting somebody else's cells into your body. And I saw that the conclusion that what if you were potentially now inheriting a gene disorder or some type of gene mutation that was going to happen in me, and now you have my stem cells in you, to where what if at X age I was going to get cancer or some type of ailment. And now it's hard to, I guess, exactly prove, but I imagine it's also got to be hard to disprove. And there's a number of different physicians that seem to be building a case on why, the fully autologous way would be the
Exosomes.
right.
Well, I know exactly what you're saying. It's a very technical description of what it is. I mean, exosomes. I don't pretend to be an expert in any of this
No,
stuff.
I'm not an expert in
But
that.
but from what I understand, exosomes are really the basics of stem cells. In other words, you're right down to the genetic material of the stem cell, and you're down to where you have the what's the word, as the beginning of stem cells, which can go in any direction.
Right.
Stem cells, technically, theoretically, what they tell you is you put a stem cell in an area where there's damage, it will take on genetically, it'll take on that area of damage and reproduce and fix whatever's broken. Right.
Right. Yeah.
And technically, and this is I heard a lot of positive things about exosomes and a few negative things when I started to use exosomes, not for me personally, but for my patients. And I started doing a lot of research on it, and I got nervous because the more you look into even stupid YouTube videos, I mean, they're pretty knowledgeable, you get a lot of knowledge through the YouTube videos. Today, I learned how to take apart a 30-year-old, what do you call it, the calculator, because I can't use my phone at the test today. Because that's what I use as a calculator. I can't use my phone because they think that I'm going to be looking into it to get answers.
To get answers off the internet.
So I asked Rosa, I said, "You got a calculator?" Because she took out this Texas Instrument from 1942 with a dead battery. So I had Jared go on YouTube, figure out how to take it apart. And the battery is in there, looked like a gigantic battery that they put in somebody's hearing aid.
Right.
And if I go to the store to buy a battery, they probably don't even have. Right. So I'm going to end up going to Walgreens to get the battery. I might as well just buy a $10 calculator. Anyway, you can learn a lot from YouTube is what I'm trying to say. But anyway, I saw some of these YouTube lectures on exosomes. And what's a scary thing about it is, like you were alluding to, you don't know what you're getting.
No.
You get somebody else's stem cells. You don't know what, genetically. But this is what turned me off about exosomes. And the people out there that give exosomes, this is all theoretical. What I say doesn't mean you could have to stop doing it. But what scared me, I wanted to, and I'm just talking about YouTube videos. I didn't do intense studies on this.
Right.
But what scared me was they said that it's still in the beginning of its genesis, where they don't know what direction it's going to go. So you take these exosomes, and they're able to identify the exosomes in a micro. What is it? I forget what they call it. The most powerful microscope. What is it
I know
called?
what you mean. Like,
like a hydro. I mean, and the most powerful. They talked about the most powerful microscope, which
electron microscope.
Like electron microscope is supposed to be the most powerful, but now they got even more powerful.
Oh wow!
Right, which now they're with the even more powerful. They're noticing that the genetic structure of it are so different that you don't know whether it will, when you put an exosome in there, like you said, it could regenerate tissue, good tissue, or it could be a exosome that can regenerate cancer cells.
Oh, right.
Right. So you don't know now if you have one cancer cell in your body and an exosome goes in it, which is more basic than a stem cell, can start that producing, just like you have cartilage that you want to produce. Right. So I mean, it's a scary. And that's probably why it's not FDA approved.
Right.
Whereas your stuff is all FDA approved. We got to mention that.
Absolutely.
You got to start somewhere. Even though FDA approved doesn't mean the insurance is going to pay for it.
Right.
So
Unfortunately.
this is what we do at the Jasper Spine Institute. Marco will. What we're going to do now is we're going to start to market it at some of the local gyms, right?
That's the plan.
Because anybody out there that listening that hurt themselves, like hurt their rotator cuffs, tendonitis, Achilles tendon, all these things as a young person. And that's, what's his name? The guy that pulled his Achilles tendon playing football. What was the guy's name? Philip would know that guy. But anyway, he's getting good real fast because guess what? They're injecting him probably with the same stuff that Marco has.
Yeah.
And that's what makes him better faster. He might not need surgery, but they inject this stuff and they get better faster.
Yeah.
So if you're an athlete and maybe you overdid it a little bit in the gym, and you feel like you tore something in your shoulder, you always get an MRI, an X-ray, and isolate what muscle it is. And I can give injections directly into where it needs to be because I do precision injections with ultrasound, which I can identify the tendons, the muscles, and put it in the right spot.
Right.
So what do you think about this, Jeremy?
Well, yeah, Wednesday, Philip and I were really grilling Marco, and I was really surprised by just how well versed he was with all of this stuff. Like just as he was talking there, man, without missing a beat, he knows everything back to front about this, and I love that.
Well, that's his job. He's got
yeah,
to know.
Yeah. No, we've had people in the office where they're talking, and it's, well, I'll have to come back with that information. Yeah. But Marco's on top of it. And that's great to have. And we've already started doing cases, right? I mean, like
we did one the other day. He came in, he was hanging out the other day, and he left, and a patient came in actually asking for it. So he was probably halfway down the street, and we called, and he came back to help because we've done a few of them, and most of the time it's a little bit different than PRP, the setup and how you mix stuff and when to mix it. So Michelle, she's the one that usually does it, my nurse. And she was like, can you call Marco back because just run it through her at least one more time and it should be good. But we got to start doing them more often. This way it's not as hard. Yeah, the downside also, it's time consuming in the office.
Yeah, you probably need to allocate 45 minutes.
Yeah, it's 45 minutes to get something in. And by the way, like I said, we don't make any money off of it, We don't make that much at all. Right. It's just really paying the overhead.
Now you have a fairly cheaper price than some of the other places, especially.
We're trying to say I should increase the price, right?
No.
But I mean, that's the cool thing, though. I mean, you don't think about the money. You're not thinking about making it rich off of everyone. You're thinking about the patients and what's best for them. That's great.
Well, I mean, I feel so bad the fact that these patients could use it, and the stupid insurance companies don't want to pay for it.
Yeah,
right?
Yeah.
And hopefully one day in our lifetime, our career, they'll start paying for it.
They're going through a process. I can't say when or if it will happen. It obviously can get denied and stay in this category it's in. But considering it's not a drug, they can't approve it. So, or, exactly cover this under any of the insurance plans that currently exist. So until we find a way out of that gray area, that's going to be the boat that unfortunately everybody's in.
I want to ask you, it's done for aesthetic reasons too.
Yeah.
Hair growth.
This is
what are all the other?
Really?
Talk about that a little bit.
This might be the most versatile product that I've ever heard of in the industry. So, just as we can target your ligaments, joints, inflammation, wherever that may be in your anatomy, there's a large demand for this in the aesthetic field. Outside of pain management centers, I go right to Medi Spas, and they have different facial rejuvenation procedures. Our product is actually only one of a couple that we could turn this liquid formulation into a gel. So when I say fully autologous, for anyone that may not be up to date who's listening, that's just matter from your own body. Okay, we take your blood, again, spin it down. We're able to isolate your plasma, and this liquid, instead of injecting that for regeneration, we could turn it into a gel with another device, which is actually offered in your office. You bought our full package with the thermal black heater, which obviously you're not in aesthetics, but
well, wait a minute. We might be getting into aesthetics a little bit here.
No, why not? I mean,
we can make Jeremy look good. Why not?
Why not? And I got a face. I got a face made for radio.
Yeah.
So
a couple of these are good. Yeah. But overall, it's used for hair restoration. It could be used for the tear trowel, any type of filler procedure. It's safe to inject.
So they inject it as fillers too?
Yeah.
Really? Let me ask you, as far as the hair and that, I guess they call it vampire facelift.
Vampire, yeah.
How is it applied to the skin?
So you could either micro needle it into the skin for the.
So they have a
entire
device,
facial.
a micro needling device.
Yes, you can do that, or you could just as you would administer Botox, just instead of the toxin, you're going to now inject the PRGF.
Did you ever see anybody do micro? Because I always wanted to do this if they have the right micro needle.
You guys could absolutely offer
Now,
it.
the micro, do you know what company they use for the micro needling?
They have one called Skin Pen. We are affiliated with another company. It really is just a matter of the head of the needle.
Yeah. Now, what do? You apply it to the skin and then use the micro needling?
Yes, and you're just kind of shaving over everywhere.
Wait, so like a tattoo gun?
Similar to a tattoo gun. Yes.
Right.
I'm looking. I wanted to design a micro needler where you could put it into a cartridge.
Okay.
Right. Put it into the cartridge and then have it actually come down and deploy it right where the micro needling is, instead of wasting it all over the skin and doing something like that.
No, I mean that would definitely be a solid idea. I don't know if it
too bad I just said it over the air. Some idiot, some smart guy's going to come up with it, and I want part of that.
We'll
all
delete
right?
it there.
Anyway, so when you do let's say the micro needling of the skin or the scalp.
So actually, I'm sorry. That's just for the face. For the scalp, you would be injecting with like a 33 gauge needle.
Yeah.
And going about it that way.
Every how many?
Maybe every ½ inch in that designated area. So what's unique with ours? There is 0 leukocytes in our formulation as well, which is something I probably should have established when I was trying to introduce this in the beginning. But the leukocytes, how we also achieve that 21-day point in the injected area, these cells will actually eat the growth factors due to an enzyme they create called proteases.
The macrophages,
yes,
right?
Yep. So this enzyme, if we can conclude it's going to eat the growth factor, it's safe to say if we could remove these, this is how you could have a much
how do you remove
longer
with the
these leukocytes, the erythrocytes.
How do you remove them?
So that comes down to our centrifuge itself. It's at a very precise RPMs. We also have it programmed for the G-force of how it starts and how it slows down. It's very intricate to where some stop at a dime. If you notice yours, it stops much slower now, gradually, with a small percentage of the anticoagulant, the sodium citrate, that also remotely aids in the separation. But overall, through our activation process, there is 0 leukocytes in the injected area. So if you can get this into someone's scalp, once injected, the microclot that forms, it is going to stay right in that area to where it is targeting exactly where you injected, as compared to some of them, you may inject it and it could be a little more, I guess, sporadic is what I'm trying to say.
Sporadic,
yeah.
Now, all right, so my hairline.
Right. Yeah.
We can do magic. Is that it? Because that's what's needed.
You absolutely could try. I actually am considering doing it in the very near future. But yeah, I mean, right here you could definitely see it's starting to go back. Unfortunately,
yeah.
And typically we would recommend 3 treatments. Maybe 5 for the
Have there been
year.
studies about that? Like
Absolutely.
the hair growth? Really?
Yeah.
What's the success rate? But it depends on the person, I guess.
It's going to depend on every individual, no matter the procedure of where it's getting injected. We don't have 100% success with every treatment, unfortunately.
Yeah.
This is really going to, I guess, overall depend on the patient, how they took care of themselves. We think that, that's got to be a
I did not take care of myself at all.
Right.
Yeah.
Well, it also depends on the root cause of your hair loss. Is this a
genetics?
Is that a factor here, or is it potentially a lifestyle change that maybe would help in increasing blood flow to your scalp? Because typically, from my knowledge, it's either DHT, which is a derivative of testosterone. It will kind of clog the follicle. And this is something that if you are able to lower your DHT levels, this might alone be a recipe for your success in order to.
What man wants to lower your DHT levels?
Right. No. So that's another good point.
That's why women don't lose their hair as much.
Right.
So now, all right. So like a woman comes in, and this is, I'm just talking from the cosmetic end of this. Yeah. And she's got like crow's feet, or she's got something else she's wanting to see the end of, you just move over it with like a tattoo gun type of thing and instant results, or what?
I mean, so for our gel filler, ideally, yeah, that is something instantaneously.
Really?
if
In
there-
other words, if they got like a crevice line in here,
absolutely,
you could fill it up and smooth it out.
that's exactly
People
right.
who have smoker lines on their lips, on above the lips.
Is that what those are?
Yeah, smoker lines. You just fill them up and they go away.
I always wonder what they were.
I used to do some of that stuff, but my practice is so busy. What I'd have to do is I'd have to find a technician. Do you have to be an MD, or can you have a technician doing this?
Oh, that's a
No,
question.
I mean, so
yeah.
you could have an RN, PA, NP, or like you said, an MD. But if they are under your supervision, you could ideally offer this at your practice. And
Well, let's start doing it. Let's start marketing a little bit of that.
absolutely, I actually have
Yeah.
a couple of different, people that as far as a PA, an NP.
So you
or,
have people that are interested
people
in.
that would potentially be looking to start administering that locally. To where if that's something you really want to entertain, I could definitely try to find you some.
We could
recruits.
probably do that. We got you and Philip involved with that.
Yeah.
Sure.
We start marketing. Here's the first marketing right here on the radio on our podcast.
Yeah.
If anybody's listening local, we are starting to do regenerative medicine in your face,
In your face.
in your head.
Yeah.
It's actually crazy. It can
That's
be done
amazing.
in other places as well.
You
So-
think this is
Wait,
funny?
hold up a second. No.
What are you talking about?
Hold
You
up a
mean like,
second. So you were born with a undernourished schmeckle. Okay.
no, I think probably it'd be erectile dysfunction. Is that
That's
what you're
right.
talking
Yeah,
Also,
or
it's-
erectile dysfunction.
There
Depending.
is actually a procedure they are currently developing for what Jeremy was just talking about.
And not just Jeremy. I think we were all
Yeah,
talking
I'm sure
about
there's
it.
a
about?
couple
No, wait a minute,
Yeah.
Jeremy, you brought it up.
That's not bad.
And I think you should be
I'm not worried about
included
that.
in this experimental.
Yes, if it's
uh,
experimental,
prospective or retrospective
although I
study.
don't need it, but yeah, no, keep
Right,
talking.
right.
Yeah.
Well, no, just as I said, if there is, somewhere in your body where there is need of restoration, as Dr. Jasper was saying, it typically would be best for someone with ED, anyone with lack of blood flow issues that's not maintaining an erection or any type of issues in the bedroom. There is a procedure. It's called the P shot. You could look into this. It is a patented
Stop. It's not
What's it
called the
called?
P shot.
the P shot, the Priapus shot. Yep. And
Whoever thought of that was having a laugh, man.
hey,
Come on.
He
But a
makes a lot of
Pisciarita.
money.
But a Pisciarita. Well, it's an Italian company. Oh, the Pisciarita.
Yeah. Well, actually, I don't know who invented that. That wasn't from our company. But what our company, I know that we behind the scenes are developing is they're looking at something to enhance the size of the male sex organ there.
Oh, even the size?
Yeah.
All right. Well,
Yeah. So I don't know if that's something you want to
I don't
bring
know
on
if that's-
too, but
now we're talking.
Oh, we have Brenda Starr here is having a great time.
Now we're talking fantasy here.
And Mike Katchmar, Dr.
Hey,
Mike, he's
speaking of
Great
Ladies.
show. Hey, Mike. Yeah.
Yeah.
Well, Mike, he's probably could get in on that experiment on erectile dysfunction or small penis syndrome. One of those.
we're all
Maybe we
lining
could
up.
Get
But,
him on that.
but I brought it up first.
right.
Yeah.
That's-
All right,
gotta-
so you'll be
you
the
know.
first candidate.
And speaking of ladies, as
So what do you
just
do?
said-
Do you just draw a bigger thing? Like what is it on it? Because I got to tell you, I have tattoos.
Right.
Okay, I don't have one there for specific reasons.
Of course.
Yeah. So is that what would be needed?
You are getting injected right in your junk. That is exactly how the procedure works.
You got to be a
well,
certain individual, man.
mean,
I got
gotta
to
tell
tell
you
you.
what.
cream involved.
We're gonna have to
So-
get a technician because I ain't doing it.
Yeah. Give him a shot.
I'm gonna have to get a very,
Hey,
very
hey,
long
look.
needle.
Yes.
Hey, look.
I might have a phobia.
There's an O
I
shot.
gotta get a
as
very
well.
long needle.
There's an O shot as well.
An O shot.
Yep.
Come on, doc.
What's OSHA?
They call it the orgasm shot. So this is for the ladies. So
Ah.
if someone isn't stimulated as much as they once were, this is actually something that can be injected down there as well. And it would most definitely improve their sexual health overall.
Really,
Yes, like I said, it's very, very versatile. So
Marco, my friend, you're doing God's work.
Anybody has a
Okay.
problem like this, call the Jasper's Planet 2 and talk to Gabby at the front desk who will not know what you're talking about right away.
Yeah, not right
You
away.
have to remind her.
Yeah.
And Marco will be the man to take care of all this stuff. And we'll get you have a nice face with a hairy head and a very, very
Strong joints.
yeah.
Oh, wait,
All
wait,
the
wait.
joints, every joint will be very strong and hard.
Mike says he's selling a product. They're special glasses that make everything look bigger.
Well, see, that
We
comes
should
in
partner.
when they come in for the shots. They get that free of charge.
Oh man,
That's part of the package.
yeah. What do they say on like rear view mirrors in cars? Some objects may
May appear to be closer than they are, or
just
further
get that
away.
tattooed right on it.
One other area where our product is showing a lot of success is the surgical aftermath. So when you have the incision marks from going into a patient, this is typically more done at med spas, whether it's a breast augmentation or something where there's excess scar lines.
Like keloids.
Right.
Somebody who has keloids, they inject that and decreases it.
So well, instead of creating that gel, we actually can form this tacky like substance to where this can go right under the bandages, which could actually increase the recovery time by 40 to 60% and also reduce any type of scarring that that patient may have.
So it's not injected
after.
directly into it. It's
No, this is something that would more so be applied topically right into that wound. And then upon being bandaged up, you will just see
and it's all a matter of taking your blood, spinning it down.
same
before-
process. Yep.
Is there
Just a
nothing
little-
this can do? I mean, this
I mean,
can't do.
it
I mean,
is-
this is.
like I said, prior to this, I was a pharmaceutical drug rep, and you hear of the different uses for drugs, but I've never seen something that can cover this many
Just
bases at-
everything, right?
Well, stem cells. It could get.
Okay,
It can
fair
take
enough.
care of everything.
Right.
Yeah.
You know,
No,
it's not exactly stem cells, but it works with the idea of calling upon your own stem cells.
Right. Exactly.
And you got to be
Right.
careful what you say. Now they're actually bringing doctors and companies to court by them saying that we are going to give you stem cell injections, and they're actually not stem cells.
Interesting.
So your company is right up front with the fact that you're not injecting stem cells,
No, this is
growth factors, and and I call it chemotactic. You know what the word chemotactic means? It means that there are like growth factors. There are things in the plasma that call upon. In other words, they call like sitting there and attracting these inflammatory products or the stem cells or whatever it takes to regenerate. Collagen products to form collagen, stuff like that. So that's good. So we're gonna do that or what?
Yeah. No, we've already talked about. We're going to get a radio commercial started. I'd like you to be in it, and I want Marco to be in it because he knows this just too damn well. You know.
You know what we do? Can you get a hold of one of those micro needlers to show me how it works?
sure.
I mean, your company
Absolutely.
Seller is a different company.
So I have to double check. I don't think we currently offer the exact setup, but we would definitely point.
Yeah,
you in the
find
right
out about that
direction.
because we could. That's something easy that we could start. What they
Absolutely.
call. What's the other word besides vampire facelifts?
Vampire
Yeah, I hate
facelift,
that.
vampire facial. What that whole term?
Just
Yeah,
the
no,
marketing
exactly.
side of it.
Yeah,
I
In
hate
other words,
that.
they've kind of gone away from that. But what it is your micro needling is very fine needles, and it's kind of a battery powered, where they might have 50 little teeny needles in a small area, which go in and out, and they poke little holes in the epidermis,
Right.
which will give access to the product.
Absolutely.
Right. And then it gets absorbed because you made these little holes without causing any scarring. And it regenerates your connective tissue. And that's why they call it a facelift. When they call it vampire facelift, why? Because you get a little bit of bleeding when you do it. Right. You might get a little redness after.
Definitely some redness.
Yeah. And then what happens is it does its effect over time. And with this product, it actually lasts longer. So it does its effect over more time.
Exactly. So for the next 21 days per se after that procedure, you're going to have that presence of the growth factors continuing to do their role, which is going to be rejuvenating your skin. And then on top of any type of puncturing to the epidermis, you're going to have the collagen is now going to be stimulated as well. So it's definitely a solid treatment.
You know what we'll do
for-
is maybe we'll pick a couple people in the office that will volunteer to do it, and just so this way we can use them as a testimonial.
Sure.
Sure. Yeah.
Make
yeah,
the
yeah.
make
I think
the
it's a good
marketing
idea.
better, and we could be more honest about what's happening.
Absolutely.
You know, that's
You know,
a
just thinking about this. Now, this would be a great thing to market at tattoo parlor, tattooists, because the same people that aren't going to mind the gun are going to want to beautify themselves. Because that's all it does. Yeah, it's a drop in the hat. Let me line up. You know, I can see that the women, and they're all ages. So you're going to get those women who are going to want those imperfections removed. And
I like where your head is going, but I actually looked at getting this into. It wasn't a tattoo parlor, but it was a salon, and it was because there's a lot of people doing just regular facials there, but who wouldn't want a micro needling session done? But by law, actually, in the state of New Jersey, you're not allowed to offer any type of injections, needle services in a salon. But what you can do, and what you did spark the idea.
well, is marketing it with them. I mean, they
Right.
can tell the people that are. I mean, we
Absolutely.
wouldn't be doing it in their
let me
place.
ask you,
Okay.
let me
Yeah.
finish what he's going to say.
No, well, just as I was, just kind of brainstorming, trying to figure out how to attract more patients to your facility, that could be another avenue, working with tattoo shops to where you're just leaving your flyer behind, a little brochure of what we potentially could offer at Jasper Spine, and you definitely could acquire, some customers there.
It's called Jasper Spine and Rejuvenation.
There you go.
I was going to say, we have, I don't know how ethical it is or it's actually legal to do, but I'm sure it is. It's a procedure, and we have the ability to do anesthesia. Like, how painful is microneedling of somebody's face? Probably not that
No,
bad,
definitely
but
not
then
bad.
there might be a little bit of pain involved. And I got patients that don't even want to get a little injection
I know.
without anesthesia.
Okay.
So
well,
we could probably, as far as that marketing goes, we could market the fact that we can do anesthesia while you get your microneedling done.
Yeah.
But
I mean,
of course, that would, who pays for that?
that's definitely
Insurance
gonna
companies
be-
don't pay for it.
right.
definitely won't be as cost effective. I mean, I feel typically when you see a high percentage lidocaine, like 20% applied, give them 15, 20 minutes prior, there is little to
Wait a
nothing.
minute, how do you apply the lidocaine? You inject
Just-
it?
No, just topically is usually what I mean. Some facilities I have seen, they will inject. You can do that, which
Yeah, well, that's painful in
I was
itself.
going to say, which kind of is
So you have lidocaine that just gets absorbed through the skin?
exactly. Yeah,
Well, that's not bad.
Yeah, it's not
Yeah.
bad at all.
I've seen some patients.
Now, how does
they're-
lidocaine affect because I know they talk about if you use dye, you use steroid, or you use some type of anesthetic, that it decreases the effect of the product.
No, it's a solid question. So, from my knowledge, I've yet to come across any publications that would indicate lidocaine being a negative factor in this equation. But I do know that every time prior to being injected, they wipe everything off. So whatever was topically absorbed, granted that may still have that numbing effect, but as far as it intertwining with the PRGF formulation, I don't see any negative factors.
What about if somebody's going to have, let's say, the product injected into their joints or into their tendons? I know with a lot of the PRP and stem cells, they don't want you to take any kind of steroid, cortisone type steroid, dexamethasone, or any kind of hormonal steroid prior to these.
That's correct.
It's still the same. And how much time ahead do you have to stop it?
I mean, typically, 48 hours would be best.
But that's it. That's 48 hours.
Yeah, I mean, that's.
I was making people go like weeks or a month.
Oh, really?
Yeah.
I mean, we would just advise anyone to just drink water. I feel like the one problem where I've seen at different accounts,
Dehydrated.
yes, and if they're dehydrated, it is not the most pleasant thing drawing blood, especially if you're doing multiple joints and you need a large kit where we have 4 tubes of blood needed. Not that it's a lot; it's only 36 ml. Or small kits, as you've seen in the last patient that you did, that was only 2 tubes of blood.
And we had leftover.
And you had leftover, yes. So he actually could have did his hair. He could have done other areas if he needed, but yeah.
Nice. All right, we're winding down. We got a couple minutes left. Does anybody have any questions? Anybody call? How come nobody calls? What, the phone's not working?
Well, we didn't. We had the guest, so I didn't really push it. But
Well, we never, or you might not push it ever because we never had a phone call on our podcast.
That's
I
true.
have the feeling there's something wrong with our
live?
phone.
No, dude, no, it's working. I got it going right here.
Yeah, Mike Catchmore, call us now. Let's see if it comes through. What's the number?
It's 732-237-4949.
Man, that could be a reason why we never get any phone calls. We never tell them the number.
That's true too.
It's not that he called 411. Can I please have the number of the
What is it?
Painless with Dr. Jasper?
That's why he's the
4949.
Yeah,
I would have
732.
promoted this. I thought you said we recorded first.
237.
Well, this is a live podcast.
Oh, yeah,
Simon.
we can get calls live. Yeah. Well, I mean, we want you to bring that tattoo thing in. So we'd like to have you back to talk about that, right, Doc?
Yeah, and tomorrow, what, 7:00 a.m. is the radio show?
Yes, from 7 to 8.
And it's on Facebook.
It's on. It'll be on Facebook. It'll be on after today. It'll be on Yahoo.
What's live now?
Google.
What is it on live now?
It's right now. It's on our YouTube and our Facebook Live, and then tomorrow it'll be on the radio and podcasts all over the world.
All right.
Yeah.
Nice.
Well, thank you very much, Marco.
Absolutely.
And Jeremy, thank you everybody for this was a pretty good show. A lot of good stuff. Oh, we got a phone call first
now
time.
You need your headphones on.
All right.
Okay.
Headphones. Put the headphones on.
Answer. Hello.
Hello.
Hello. Gabe,
Hey.
can you hear me?
Yeah, who's this?
This is Dr. Kaczmar.
Oh, all right. You calling in for an appointment for
well,
enlargement
listen,
of the penis?
I'm upset that you question the integrity of the equipment in my studio.
No, I wasn't talking about the integrity of it. I was talking about the integrity of the person running it right in front of me.
Right. He's eyeballing me across the table.
Well, what I'm going to get you guys is earpieces. So I see you don't use the headphones, which I know are cumbersome. But anyway, the quality of the sound really looks great. And no, the phone works. It's important. We have people calling in on our show, so it definitely works.
Well, I think the problem was we never told them the number.
Yeah.
Well, Jeremy has it right there. Jeremy, it's the weak link. Jeremy, he's got to put the phone number up. I'm just sitting there. I got to tell him. So you can't do everything, Dave. We have Jeremy there.
You're gonna throw your shoe at me.
Next time this happens, call in and remind Jeremy.
Call in. I got to call in and remember Jeremy.
I thought you were yelling at me for doubting the integrity of your what do you call it over there?
No. Yeah, I'll make a point about that. When we were in with WOBM, remember people used to call in. You remember the hassle? It used to cost $20,000-$30,000 of equipment to have the ability to somebody call in. With this stuff we have now, the new technology, it's amazing.
Yeah.
But this was a great show. That drug rep you have there, I just want to give him a shout out. I can see his intellectual prowess. You're very good. You're good at what you're doing. My wife's a drug rep also, there's your stuff, and this is an area that's really growing, and I'm very interested in it, and I think there's a lot of future there. It's just that it's unfortunate the insurances don't cover it, but I think they're eventually going to have to, as long as the studies keep showing positive results.
I definitely appreciate that. That's
no, I can see. When I do vascular, when I was doing my vascular stuff in the OR, we had reps come in here that were just wow, man. They the knowledge they had. So we really appreciate it. It helps us out a lot. It really does. Yeah. So, Gabe, it was a great show.
Thank you.
I thought it was
Let's
really
get
good.
together soon. I miss you.
Yeah. Well, listen, we got to talk. We got a great future. I got, I'm bringing I'm bringing somebody on to take the reins over the practice to do some of the heavy duty lifting.
Good.
Yeah.
Bring him in the office. I want to meet him.
Yeah. Well, we're still negotiating, but then we'll probably work out at a surgery center. But there's a lot of new technology with foot and ankle surgery as well. That it's just really a lot of minimum incision surgery that's starting to really come around. So we're very excited about all of that. So we'll bring it to the next level. But anyway, it was a great show. I'm going to sign off. We'll get together. Jeremy, I'm only kidding around. You did a great job, Jeremy.
No, I know. Thanks, buddy.
You're top of the line, and that I'm so happy that you guys utilize that place
And
there.
thank you
Was
very
the
much.
driveway, a little on the side. Was the driveway clean this morning?
Oh, it was beautiful. It was beautiful.
Oh,
Okay.
that was
Well, I
good.
did. I made sure for you guys. I can't have my.
Yeah, we're the talent.
We
I got to find somebody to do something like that in my driveway.
Yeah.
Hey, listen. Just so you know, Gabe. I'm high end. We're 18 here. We don't mess around.
You're high on what? Would you say you're high on what?
We're high end. No, we're high end.
How high are you?
So anyway,
how are you? How are you? How high are you?
No. But listen, you were talking about that mushroom stuff and everything.
Yeah.
There's a huge couple of papers just came out for people who are addicted to drugs, especially alcohol, chronic alcoholism. I mean, it's amazing. They put them in this, 24-hour. I don't know. I don't want to say semi-coma, but it's really interesting. That whole area. It's been they did work with that years ago. The psychedelic drugs.
Yeah, we'll test it on me, Mike. We got to start doing shows again, and we'll do it on me.
What we can do is make a big plate of spaghetti with magic mushrooms.
Yes,
and we serve it to the patients.
I'll give you my real quick story. I know you guys are pushing.
Well, we got Dr. Schneider.
We got Dr. Schneider coming up.
Come on up, Dr. Schneider.
So listen, real quick. I was down in the Caribbean.
This could be a long story here.
No, real quick. We had dinner. The locals made us this dinner, and we went out there, my wife and I, and they offered us some punch. I started drinking it, and in about 5-10 minutes, I was looking at my wife. Her nose was starting to move and melt and everything else. And what they all started laughing. And what they do is they have mushrooms down there, and they do it in Tortola and other islands. It's mild, but it's a hallucinogen.
Well,
and I didn't know they put.
Did her nose ever go back to normal?
Yeah. Well, I started drinking that stuff, but I mean, it's around the world. It's used a lot, and there's a lot of potential there.
Here
So anyway,
comes Dr. Barbara Schneider.
All right, tell Barbara
we gotta go.
hello.
Okay, goodbye.
I will, Mike.
Bye.
I will. Take care.
Take care.
Bye-bye.
Bye-bye.
Thank you, everybody. Goodbye.
Take care, everybody. For more information about Dr. Gabriele Jasper and the wonderful things we talk about, please go to jaspermd.com. You can also make an appointment at 732-26